Good morning, everybody, and welcome to the Bipartisan Policy Center. For those of you who are here in our offices and for those who are watching us on YouTube this morning. I see several faces I remember, and good to see you, some new faces. I'm Bill Hoagland. I'm Senior Vice President here at the Bipartisan Policy Center and have the pleasure of working with our health team, our fiscal policy team, and others here at BPC. It is the Center's distinct pleasure to serve as a venue, bringing together all of you to listen, to participate, and hopefully by the end of the day identify some federal policies that we might be willing to consider and the White House willing to consider in the forthcoming White House Conference on Hunger, Nutrition, and Health. Today's proceedings were brought together under the leadership of a task force that was chaired by former Secretary of Agriculture Dan Glickman, former Majority Leader and my last boss on Capitol Hill, Dr. Bill Friss, Ambassador Ethan Cousin, Chef José Andrés, and Dr. Derry Musafarian from the Tufts Universities. You'll be hearing from a few of these chairs in just a few minutes. Before I forget it, and I want to give a special shout out and thank you to the staff of the Friedman School of Nutrition Science and Policy at Tufts University, led by Jennifer Weber, who's here, helping to organize not only this, but two previous hearing sessions in California and in New York. I can tell you putting this together along with the BP staff led here by Nelly Askew back here, this has not been an easy logistical situation, but I'm very pleased that all of you could make it today. Before I turn it over to the co-chairs, please allow me a brief observation. You'll see back there in the corner one of the four founders on a photograph, one of the four founders of this organization, the Bipartisan Policy Center, was the late Honorable Robert Dole. I had the honor of working with him in the late 1970s as he worked to implement many of the recommendations that came out of the first White House Conference on Food, Nutrition, and Health in 1969. I know he would be extremely pleased today that this organization that he helped found is hosting this convening with you specifically invited thought leaders in governance, agriculture, food, nutrition, and health. In the 1970s, Senator Dole, in a bipartisan manner, worked with Senator George McGovern to address the issues of hunger in the United States. Their work was clearly instrumental in reforms to the then food stamp program, SNAP program today, of course, and expansion of the federal child nutrition programs. As a result of their work and others, I think the country has made much progress over these last 50 years addressing the issues of access to food in the country. But unfortunately, we still see that food insecurity is with us and that diet-related illnesses remain a major public policy issue to be addressed. I know Dr. Musafarian will get into that. And while our discussion today will be focused, let me just, as a sidebar, on domestic policy, let us not forget that globally, nearly 250 million are on the brink of famine because of changing climate and a brutal war in Ukraine. The basis for this forthcoming White House conference was a bipartisan resolution. It was adopted earlier this year, sponsored by Representative Jim McGovern and Senators Booker and Braun and Congresswoman Orlitsky. I hope this convening will continue the bipartisan legacy of Senators Dole and McGovern as we continue to address these challenges going forward. Let me now turn this over to Chef Andrés, who renowned chef and humanitarian. We have his representatives here today also. He will join us via video. I think we all want to thank the chef for all he and his team does and continues to do, particularly to assist the people of Ukraine in their time of need.
So, hi everybody, my name is José Andrés. Some of you may know I'm a cook, and like many of you, participating in the many ways that we believe that we can be fighting against many of the issues that seems we face, and where food seems is always in the middle. For way too long, it seems that food is always the problem. Food creates hunger when there's not enough of it. Food creates obesity when it's too much of it and the wrong food. Food sometimes is the cause of war. Sometimes war creates famine. Food in some cases can be part of climate change in the way we cook with charcoal. Food is in many ways a national security issue if we don't take food seriously. At the end of the day, it seems food is the problem. And I believe that food could be the solution. I know you believe that too. But we are in a very historic moment. The last food conference that happened at the White House with many amazing outcomes happened over 52 years ago in 1969 during President Nixon times. Now with President Biden, we have this amazing opportunity to think when we all come together as one, when we put food in the table and we believe in longer tables, that we can actually, for once, transform food the problem into food the solution. Food can be ending hunger. Food can be improving the nutrition. Food can be reducing obesity in America and around the world. Food can create jobs. Food can create peace. Food, at the end, can help us fight climate change. Food, if we treat it seriously, can be the solution to many of the problems we face. But we will only do this if we come together. And being together meaning that what is good for one group, fighting for something that is the right thing to do, has to be good for the other. We need to compromise. We need to understand that this is not people just trying to say, I am on nutrition, or people that say, I am in anti-hunger. No, it's all the same thing in more ways than one. This is what this White House conference wants to achieve, where President Biden wants to be in a bipartisan way in many ways, but also bringing everybody together with the right solutions. Only then we will improve in the next 50 years America through the power of food. One plate of food at a time can help us create a better tomorrow. Remember, good policy is good politics. And good policy must be here to serve every American, every group supporting food. If we all believe that together we can make it happen, I do believe out of this conference, great outcomes can happen, that we will deliver what we all want to the American people, where food stops being the problem and it starts being the solution. Please, let's all join efforts as one, we the people.
Well, it's hard to follow José Andrés on anything. And the word passion is, you look in the dictionary, there's his picture. And he's, of course, been over at his own risk, helping millions of people in Ukraine and many other parts of the world. So I'm delighted that he's one of the co-chairs here. I would welcome everybody to this particular convening. I have a relationship with the Bipartisan Policy Center for many years, great love for it, but it's appropriate that our final listening session is here. Because the BPC has stood for cross-partisanship, bipartisanship, to bring people together where possible to work on problems that are solvable. And in the areas of food and agriculture, while there's still some conflict between people, by and large, those areas have escaped much of the highly degree of partisanship that have existed over the years. So it's really important that we recognize that food, hunger, nutrition, and health are not partisan issues. They're human issues, and the bipartisan support for this initiative reflects a major opportunity for change. I just want to mention a couple of people who are here. There are many people who deserve recognition, but my friend Tom Harkin, former senator from the state of Iowa, who led the effort in the appropriations process for years to fund nutrition and hunger and health-related programs, and now he has his own center in at Drake University and Iowa and many other things, but I think he deserves a special hand, you know, so and then Bill Hoagland talked about the fact that while this is a domestic conference, these issues are global. You know, what happens in one part of the world, like in Ukraine, affects food prices in the United States. And we were fortunate, I don't know if she's still here, is Agnes Kalabata still here? Agnes runs the Alliance for the Green Revolution in Africa, which is leading the effort to fight hunger in Africa, working collaboratively around the world. And I think I want to make sure she gets a hand as well. I think it's important to recognize, Bill talked about this. This conference happened, the original conference happened in 1969, and it was organized by Tufts University, by Dr. Jean Mayer, the founder of the Friedman School of Nutrition, and it was the leadership of President Nixon, Senators George McGovern, and Senators Bob Dole that made it happen, and that created the opportunity for all that followed. Now, just imagine that in today's environment. We had a conservative Republican president of the United States work with a liberal Democratic senator and a moderately conservative Republican senator. Bob Dole has passed, but I don't think he'd get too upset if I called him moderate Republican, right? You know, any event, and created the environment for all the things that conference did. It established much of the current U.S. food policy framework, major expansion and harmonization of the National School Lunch Program and the Food Stamp Program, now SNAP, creation of the School Breakfast Program, the Special Supplemental Nutrition Program for Women, Infants, and Children, the WIC program, which has had a profound effect on mothers and young children, and new consumer protections like consumer labeling. So it was amazing what that conference did. And we're talking about a lot more needs to be done, but I do think that we should recognize the United States has been a leader in the issues of food and nutrition over the years. So there's a lot of good things, great things that have happened. We just think that there's an opportunity for more work to be done. So we are facing new challenges in the food system, including food and nutrition insecurity, chronic hunger, high rates of diet-related chronic diseases, and related nutrition and health inequities. And Dari Mazafarian, the Dean at Tufts, who's been the spearhead behind this particular event, I think we'll talk about a lot of those as well. But anyway, all those things are harming Americans and costing the country hundreds of billions of dollars in preventable health care spending every year. So here are a few statistics. In 2020, 38.3 million Americans, including 11.7 million of U.S. children, lived in food-insecure households, unable to always afford food, according to USDA, my former agency, and those numbers went up as a result of the COVID epidemic. Healthcare spending has skyrocketed, driven by costs of diet-related chronic diseases, diabetes, obesity, cardiovascular diseases in all stages of life, and frankly in all income levels as well. Today, nearly 3 in 4 American adults have are overweight or obese, and 1 in 2 have diabetes or pre-diabetes. In other words, more Americans are sick than healthy, or will become sick, certainly in the future. And people of color face higher rates of diabetes, obesity, stroke, and heart disease than others. Health outcomes have worsened despite advances in nutrition science over the last 50 years, indicating ineffectiveness of disjointed, fragmented efforts for translating findings into action. And I just might add, just recently, this is a thing that affects everybody, but health and food price inflation have had a great impact on what people eat and how they're needing to access the nation's food banks. Just this morning I saw on the news that one food bank, San Diego, which served an average of 350,000 people during the designated time period, went up the last 4 months to 500,000 people just in that particular community. So just imagine that's how it's replicated. And in large part it has to do with the higher costs of food, gasoline, and healthcare issues. So anyway, to try to inform and help achieve these goals, several groups, including the Chicago Council on Global Affairs, the Food Systems for the Future, the Friedman School of Nutrition Science and Policy at Tufts University, and World Central Kitchen, formed the Task Force on Hunger, Nutrition, and Health, along with an accompanying strategy group composed of various groups working in these spaces, and there are some people representing the strategy groups here at this meeting. I do want to note that this task force was not convened by the White House, but represents an independent effort to convene voices from across the nation to help solve the issues at the heart of the conference's focus and to help advise the White House on the conference that will be held later on this year. We do not have the details on the exact date or format of the conference, but we're in close communication with the Domestic Policy Council and their leadership around key issues and recommendations. But it is our job not only to do our independent work, but to advise the White House on things that they might consider in terms of specific recommendations. I'm honored to be one of the co-chairs, and I'm looking forward to today's event, which is one of 3 convenings and multiple listening sessions across the country involving hundreds and hundreds of people in academia, industry leaders, nonprofits, and users of our current food system, people who participate in food SNAP program, school meals program, and other kinds of things. People with diverse lived experiences that I think are very important. I want to thank the BIA, I think it's BIA or BIA Echo Foundation, the Young Family Foundation, Hand Foundation, World Central Kitchen for supporting these findings, and again the BPC for hosting today's event. Out of this work, the task force is crafting a report of policy recommendations and deliver it to the White House conference planners ahead of the official gathering in September to help inform their work. I believe I have heard dates floating around as the date of the White House as requested feedback, but we're going to try to get our report to them by the end of this month so that they can proceed on including their recommendations in whatever they're doing. The report will include recommendations to support a national strategy to end hunger, increase healthy eating, and reduce prevalence of diet-related chronic disease. This report will be part of a package of materials that will include records of the listening sessions and the policy meetings that we've held. Thanks to the leadership of the administration and congressional champions, bipartisan congressional champions, this White House conference has expansive goals and is coming together even more quickly than the first. In fact, all of this has just happened as the White House conference was just announced in May, 2 months ago. So you think that how fast these things are going, in large part led by the Tufts effort. So everybody in this room is a key part of this effort. The discussions we will have today are a critical part of crafting the recommendations. I realize this report can't cover everything in the world. You know, there are a lot of people who say, why don't you have this, why don't you have this, why don't you have this, why don't you have this? Well, this is a task force on hunger, health, nutrition, and related issues. And so we're going to do what we can here. We realize that there's holistically that it is connected with a lot of other issues, but together we can craft recommendations to end hunger, improve nutrition, and reduce diet-related chronic diseases. So we have 2 shared video remarks I'd like to have shown right now, bipartisan remarks, one from Senator John Cornyn of Texas and Senator Cory Booker of New Jersey. And if you would show those.
Hi, I'm Texas Senator John Cornyn. I want to wish you all a warm welcome to today's event, and thank you for inviting me to speak with you. I'm proud to have worked with many of you on legislation to enhance nutrition and feeding assistance during the COVID-19 pandemic. From waivers for the school meals program to the coronavirus food assistance program for food banks and farmers, I appreciate your support and cooperation. As we move out of the pandemic and the needs of our country continues to evolve, I'm pleased to see you working together again to support the many American families struggling to put healthy food on the table. Again, thank you for inviting me to join you today, and keep up the great work.
Good morning, everyone, and thank you for participating in this really important national convening to inform the upcoming White House conference on hunger, nutrition, and health. Today in America, we are facing a crisis, a nutrition crisis, where diet-related diseases pose a serious threat to the health and well-being of our country. Poor nutrition is the leading cause of poor health in the United States, and it's killing an estimated 500,000 Americans a year, with disparate impact on those who have lower income and education, those who live in rural areas, and those who are racial and ethnic minorities. Nearly 1 out of every $3 in the federal budget now goes to healthcare spending, with 80% of this money paying for the treatment of preventable diseases. And these costs continue to rise. Currently in the U.S., half our population is pre-diabetic or has type 2 diabetes. In 1960, approximately 3% of the U.S. population was obese. Today, more than 40% of Americans are obese. And more than 70% of Americans are either obese or overweight. Even more shocking, 1/4 of our teenagers today are pre-diabetic or have type 2 diabetes, and obesity is the leading medical reason that 71% of young Americans are disqualified for military service. The deadly nature of our nutrition crisis has been tragically magnified by the COVID-19 pandemic, where we have seen much higher hospitalization rates and death rates for people with diet-related diseases. And the resulting economic downturn caused by the pandemic has left more Americans food insecure than at any time since the Great Depression. Now, as you all know, President Nixon convened the first and last White House Conference on Food, Nutrition, and Health in 1969 in order to better address the urgent national concern of widespread hunger in America. What resulted was policy changes, an unprecedented expansion and creation of vital programs, including WIC, to tackle the hunger crisis. Fast forward 50 plus years, while we have made progress in addressing hunger in America, we are still grappling with food insecurity and now face this massive second food crisis, one of nutrition insecurity, to where too many Americans are overfed but undernourished. This has led to an explosion of those diet-related diseases we were talking about, diseases such as type 2 diabetes, heart disease, stroke, and certain types of cancer, and chronic kidney disease that are among the leading causes of preventable premature death in our country. The policy outcomes from this upcoming conference have the potential to address the far-reaching consequences of nutrition insecurity that currently harm our country, and ultimately the roadmap to improve nutrition and hunger and reduce diet-related chronic diseases in the United States by 2030 that is expected to come out of this second conference will save lives and help us build a society that is more equitable and just, a society with elevated well-being and infinitely more possibility. So I'm excited for what we can accomplish together. And again, I want to thank you for participating in this critical work. We're all tied together in bending the arc of the moral universe more towards justice. It's time that we get back to focusing on the thing we do every single day, multiple times a day, which is the food that we eat and provide for our family. We know we can do better. We must do better. Lives depend upon it. But you know what else depends upon it? Our future, which isn't just the possible bad. It is the great opportunity for us to do good. I thank you for participating in this conference. I am so excited about the work we can do and the things we can achieve together.
Thank you, Senators. Before I introduce our final co-chair, I just want to return to an issue earlier, and that is I have to remind people that not only did Senator Dole work with Senator McGovern, he worked with Senator Tom Daschle on the Americans Disability Act in a bipartisan manner that we honor. Dr. Darian Musafarian, Dean for Policy, and Jean Meyer, Professor at Tufts Friedman School of Nutrition and Policy. As was already mentioned, it was Dr. Jean Meyer who was the principal organizer and chair of that first White House conference and a special advisor to President Nixon at that time. So, Dr.
Thank you so much. I don't have a lot to add to all of the dire statistics. It's really just incredible what the country faces, and I think everybody here in the room and hopefully watching online recognize this. I think what's really exciting is that this is a moment that everyone in the food and nutrition sphere, across from farming all the way to health and wellness, is getting really excited about transformation. And the government is getting excited. There's been interagency working groups working on this for months and months, even before President Biden's announcement. And so I think there really is an incredible opportunity for historic change. You know, I'm grateful to the Bipartisan Policy Center for hosting this event. It is appropriate that this is the last event we've had. We've been working with national convenings, over a dozen listening sessions, review of publicly submitted reports, over 75 reports. And I think it's very fair to say that this resulting report will be the most multi-stakeholder report going to the White House, the most consensus-driven report going to the White House. And they're really excited to see that. They're really excited to see a report that literally hundreds and hundreds of people have given input to. And you, in our last convening, will see the recommendations and we'll comment on them and we'll update them in their closest to final form. And so I think this is a really important event today. I want to highlight that our task force has worked really hard to not have this be sort of a top-down approach, but to really focus on people with lived experiences, people with lived experiences in food insecurity and hunger, poor nutrition, diet-related illness, to talk to them and ask them and hear from them what would be important to them. And I think if my first slides can come up. Oh, I have a clicker here, thank you. So I want to just you know, highlight some quotes from some of these listening sessions and end also and show you a video just to center us before we continue on with panels on you know, the issues that we're thinking about. So this is a quote from one of the participants in one of our listening sessions. The thing about poverty that relates to hunger is there is a vulnerability at how quickly someone's life can change from being stable to being unstable. It's really key when it comes to addressing poverty and hunger. We saw that with COVID-19. We see that with inflation. We see that with war. We don't have a consistent, stable food system that can equitably, that is equitably addressing these issues. Another quote from a participant, and the most difficult part about the challenge of cooking when you ain't got no place to stay is you have to improvise. And you can't cook and eat the things you would like to eat to put in your body. You know, so this is a person who knows that they're not eating healthy food and doesn't have even a consistent place to cook and prepare food. We have to run ourselves to the ground in order to make ends meet, and there is just not enough to buy healthier food. You know, a theme again and again and again. It wasn't that the grocery store wasn't there or that the food wasn't there. It was the time, it was the effort, it was the cost of doing these things. This doesn't, oh, there we go, sorry. A little bit of a delay here with the clicker, excuse me. Sorry about this. I don't know if someone else can control it. If someone else can control it, go, there we go. One more forward, that's backwards. Can someone else go, there we go. Oh, one more forward. Okay, so this is someone who is, that we spoke with who's a participant in a produce prescription program where the healthcare system and their doctors are actually giving them healthy food to eat. The produce program is a godsend. Not only is my A1C going down, I'm having a better time with my family. It's focused on food, but not like it used to be. And this participant, a veteran from Iowa, talked about her 11-year-old son and how they used to pick him up from school and they would go to the fast food, nearest fast food restaurant to get a snack. And now when she picked him up, he wanted to go to the grocery store and get produce and cook together. So not only she felt better, not only was her A1C going down, and she had never been able to control it before this program, but it changed her whole relationship with her family around food. And as a cardiologist, I think about the healthcare system. You know, there's some really effective drugs now to treat obesity, and those are effective drugs that should be prescribed and patients should get them. But the cost of those drugs is about $16,000 per person per year for life. And so that's about you know, much more than the average family spends on food for just one drug. And if the 40% of Americans who have obesity get treated with that drug, it would add $1.7 trillion to our $4.1 trillion national healthcare bill. So it's just not feasible, right, to get out of this with drugs. We have to think about healthy food. And I think the next slide should be, after this one is the video. My son being excited about getting involved in the food process is helpful to me because it makes me think about what we are eating, another produce prescription participant. I think go forward and it might be the video after this one. It's not. This is great. Often, and from a listening session participant, often you are making choices on what is available to you. We shouldn't expect people to search for food outside of their communities, yet we do so for poor people. So a challenge with getting what they're needed. And so we wanted to show you a video as well that was of a participant from a produce prescription trial that we're actually implementing right now. So this video was taken very recently with Kaiser Permanente in Southern California. And this is a trial among mostly low-income, mostly Hispanic patients with uncontrolled diabetes who've been in and out of the health system for years and not been able to control their diabetes. And now we're doing a randomized controlled trial, giving them healthy food, not just fruits and vegetables, but whole grains, beans, nuts, seeds, legumes, healthy cooking oils. And this is a video of one participant's experience so far, as well as a doctor that's working with this patient.
My name is Karen Douglas. I'm 46 years old. I am a type 2 diabetic, and I also have CRIPS, Complex Regional Pain Syndrome.
We provide a fairly broad selection of culturally appropriate foods, fruits, vegetables, whole grains, plant-based, that our members can select from. And then they are essentially delivered to the doorstep. And the goal here is that we are facilitating access to healthy food and consumption of healthy food and help individuals control their medical condition, their diabetes, but even bigger than that, help meet some basic social needs, which we know will have ripple effects beyond just a chronic health condition.
My Dr. Carlos Humberto Silva here at Kaiser Permanente recommended me for the program. They signed me up, they called me on the phone, asked me would I be willing to do it, and I was like, produce program, like, what's a produce program? And then they told me, and they were like, okay, we're going to send you produce for 6 months. I said, you're going to send me produce every week for 6 months? Yeah, are you willing? Yes, please sign me up really fast. It was wonderful because it literally was just going to be right there at my doorstep. I mean, who could beat that? It was exciting every week because it was different every week. It's kind of like, a kid opening presents because it was like, oh, what's in the bag? I got grapes and strawberries and plums and apples and apples and squash, cilantro, zucchini, black beans, walnuts, pecans, peanuts. It was just a cornucopia of fruits and vegetables. Green peppers, red peppers, orange peppers, yellow peppers. I was like, uh-oh, fajitas, It was because it just made it so pretty, and people don't realize you eat with your eyes and your nose first. So when you see something, if it looks very like edible and that it looks beautiful to your eyes and you can smell it, then you want to eat it.
So our produce prescription program, it really falls under this larger umbrella of food is medicine. So we know for a lot of things, a lot of the common chronic conditions that affect society today. So we're talking diabetes, high blood pressure, overweight, obesity, heart disease, heart attacks, strokes. All these things are extremely common nowadays. They're largely being driven by nutrition. There's been really well-designed studies recently where even when you take into account physical activity levels, it's still the nutrition that's primarily driving these health conditions.
If you start to eat differently, your body can fight better and your body does better. Until I started getting the produce box, I wasn't losing any weight, and I haven't changed any of my exercising because of my CRIPS. I don't exercise on a daily basis, which I miss it, but I can't because it just hurts so much. I can't. But because of the fresh produce, it gave me more energy. I feel better.
Spreading that awareness that these types of foods, these healthy, nutritious foods, they literally make you feel better. They give you more energy. You get more out of your life. It's not only about treating a chronic condition that's costing a healthcare plan a lot of money. No. This is about getting everyone to feel better, to understand these foods will make you feel better, and to hopefully improve their consumption so that people can get more out of their lives.
I stopped ordering cookies. I stopped ordering chips. It's jump-started that in me to, you know what, I've lost 10 pounds, and if I can lose 10 pounds by eating better, I know I can lose more weight.
From a food is medicine standpoint, we're literally trying to treat food just as we treat medicine, to put it on the same pedestal where we're willing to prescribe it.
Because I'm already on that journey because of the prescription box, I just kept it moving forward. I want to lose weight, enough weight, so I don't have to be on the diabetic meds and hopefully not be type 2 diabetic anymore, because it can be done, you know. So it's hard work, and it makes, you know, with having CRIPS, it makes it harder. But I am inspired to keep it going because, like I said, the prescription box made me do better. So when you do better, stay on that better course.
We all kind of know it, but like when you see it, it's just incredible. And this is the future, right? This is the future that is really not that far in front of us. And there's sensible policies that will save money. Like, this is the great part that should make this a bipartisan effort. This will actually save money to do this. And an analysis from the Rockefeller Foundation published last year found that for every dollar we spend on food in the United States, we add $1 to the healthcare budget right now because of the kind of food we're eating. So we're spending $1 and we're adding $1 to the healthcare budget, right? That is not sustainable. We should be spending $1 and adding nothing to the healthcare budget, or even better, spending $1 and reducing the healthcare budget. So I just want to go to my last slide, please. And I think, please go forward. Yeah, so this one. So I think this is a great quote to end on and think about as we go into the panels and then at the afternoon session. There needs to be mindset changes and understanding that if we, and by we, I think the whole country and the whole world, are going to continue to eat and survive healthily, there needs to be more support for systems, right? So this has to be systems change. This is not about the individual. This is not about choice. This is not about blaming the victim. The system is broken, right? When the vast majority of Americans are sick, when kids are sick from food, there's a system problem, and we can fix it. And I'm really optimistic that we can. So thank you so much for being here.
Thank you, Darian, for very helpful for setting up the discussion that we're going to have and put all these people to work in a few minutes. We're going to take a quick 10-minute break and thank our viewers on YouTube who have joined us today and wish them a good day. We are going to take this break, give us time to set up the stage here for our first panel discussion, promoting and coordinating access of food and nutrition programs, and I believe, Derry, you are going to moderate that particular panel. I'm sure if you haven't found, the facilities are out by the elevator if you need anything. We'll just take a quick 10-minute break.